welcome in. Today, I'm going to be cleaning out this lady's canal wall down mastoidectomy, which basically means that she has a large cavity inside her ears that gets pinned with debris. She actually had ear problems when she was a kid, which is actually pretty common for a lot of chronic ear patients. So when we say chronic ear patients, these are patients that had lifelong ear issues. And I already always explain to patients that when someone had ear infections when they were a kid, based on their anatomy while they were growing up, it made them a little bit more predispositioned to have ear infections. Just because, one, there's something called the eustachian tube that actually connects the middle ear, which is the space behind the eardrum, to the back of the sinuses. And when you are a child, that eustachian tube is actually a little bit more horizontal. This is actually one of the fun facts that I tell patients. This makes it a little bit easier when I can use my hand gestures, but when the eustachian tube is horizontal, you can't drain the middle of your ear as well. So when a child has just a normal cold, the idea is that that bacteria can kind of crawl into the eustachian tube a little bit easier. So that's why you actually see kids get middle ear infections more often, or just an ear infection. And the idea is that when we get older, the eustachian tube angle kind of drops. As an adult, your face gets longer and bigger, and your eustachian tube gets into a gravity-dependent way that can drain better. So that's why adults get a little bit less middle ear infections. But, oh my God, this is such a big cholesteatoma, earwax that I'm pulling out. Here I'm using a bunch of different instruments. I like starting off with non-suctions because, as you can see here, the earwax itself is kind of on the gummy side, and usually those do better with dry instrument, just because when you use a suction, I kind of need a little bit wetter earwax to pull out successfully. But anyways, kind of going back to this lady's presentation. So she had lots of ear infections when she was a kid, multiple ear tubes. And usually what happens is that for those people, because they had so many ear infections when they were a kid, their ear actually doesn't develop very well. So the ear bone itself is called the temporal bone, and there's a lot of different sections about within the temporal bone. And there's something called the mastoid, which if you feel behind your ear, there's a kind of round, kind of down-facing piece of bone there. That's called the mastoid. And a lot of the surgeries that I do for ear surgery is something called a mastoidectomy. And she had a version of the mastoidectomy, which I'll explain in a second. But basically, as a kid, you get lots of ear infections. The mastoid is supposed to have this kind of honeycomb bone that's inside. And when that bone gets infected or has had bad eustachian tube dysfunction because you were a kid, and it's a vicious cycle because you got an ear infection, your eustachian tube doesn't work very well, your mastoid doesn't develop well, and because of that, you get more ear infections, and the cycle goes on and on and on. What eventually happens is that these children become teens, and they have issues when they're a teen, and then as a teen, they have issues when they're an adult. And another byproduct of all of this is when you have kind of untreated or even treated ear infections over and over again, you run the risk of developing something called cholesteatoma. And with cholesteatoma, this is essentially skin that gets into the middle ear. So let's say your eardrum ruptures, and most of the time it heals up just fine, but there is a small percentage of people that skin cells get into the middle ear. And that's bad news bears. That means that the skin can start growing into a little sac. And you might think, oh, this is just skin. It can just heal up by itself. But the issue with having skin inside the middle ear is that it starts growing. And that's what we call cholesteatoma. Cholesteatoma, that word is kind of misleading because you would think that's related to cholesterol. And that's actually why they named it that, because when they first saw it, they're like, oh, it looks like cholesterol, which, to be honest, you don't really see it. But they were thinking that it has some relationship to it. But what it is actually skin cells that are in the middle ear. And over time, those skin cells will start destroying the inside of the ear. So for this lady, about a decade ago, she was found to have cholesteatoma. It was kind of eating away at all the insides of her bone that she eventually needed to have this surgery called Canal wall down mastoidectomy, meaning that we had to take out her ear canal because it was already getting destroyed by the cholesteatoma. What ends up happening with canal wall down mastoidectomy patients is that they usually need to have routine maintenance of their ear canal because, as you can see here, she has this huge opening inside of her ear that actually pins debris or earwax. So all this kind of nasty crusting and earwax is because now the ear can't clean its earwax well enough by itself. So theoretically, I mean, for her, I think I'm seeing her again in about 6 months, but I think it's been about 3 years since she was cleaned. And for her, she was having no other issues. She wasn't having infections on top of that, or on top of this. But you can imagine that if you have a little bit of water going inside your ears, you're going to have some massive problems brewing inside your ears with the little bit of bacteria going in, with a little bit of humidity, and then you start having big infections. But fortunately for her, she went through 3 years without any pain or any discomfort or any infection. So, by the time she saw me, it's this whole video where I was just cleaning out all this earwax. I think she said that life was getting busy, taking care of her family, and there was no long-term issue with having to clean out her ears. So I think for her, it was just more about, it took a little bit longer to clean her ears. I think end to end, it probably took me about 15 minutes to pull this out. But man, I just love cleaning out dry earwax from a mastoid cavity just because there's just so much, and people can get a lot of symptomatic relief from cleaning out their ears like this. So this is like the last little part. And I remember laughing with the patient because I just do small talk while I'm chatting with them because, it is therapeutic for them. It's kind of therapeutic for me because I think in medicine there's so many things that physicians can't fix, at least immediately. And I like doing earwax cleaning just because it is such a mechanical problem with an easy fix that people feel really good about. And I think for me, it's really fun to just be able to kind of have a low stress conversation with the patient. So yeah, this is a very clean mastoid cavity here. What I'm kind of pointing at is actually the remnant of their eardrum. That little bump or that long bump right there is actually the facial nerve, which is an important structure when we do surgery because that part right there actually, or that nerve controls all the movements of your face, your blinking, your smile. But yeah, that's all I have for the video. I do take that little piece of earwax out there. But yeah, if you like this video, I'm going to be hopefully making more content like this. And I'll probably release a non-verbal version of this video as well if you don't want to hear my voice or hear any stories. But thanks for watching.